Hello everyone, on behalf of Moja Ramesh Amity's Health Tourism Company, once again I'm here with you to talk about the post-operative instructions for hair transplant, which we briefly covered in our previous video. For hair transplant surgery, before the surgery, it is highly recommended to stop smoking if you're a smoker and drinking alcohol for 2 weeks before the surgery and 2 weeks after the surgery. Now, upon the completion of the surgery, you need to go home and rest until the next morning with minimal activity, and to subside the swelling, it is highly recommended that you sleep with your head elevated at a 45-degree angle from your body. That you can do with extra pillows or use of a recliner. And one thing to consider is that you need to avoid aspirin containing medication and products and alcohol for 3 to 5 days after the surgery. That is very important because aspirin has blood thinning properties, and it can affect the bleeding after the surgery. Now, what to do if the following cases occur? The first one is bleeding, which is normal for the first few days after the surgery. And it is nothing to be concerned about if it's light. To stop the bleeding, you need to only apply pressure, steady but gentle pressure on the transplanted area that is lightly bleeding, without lifting the gauze that's covering their transplanted area or the donor area. And if the bleeding is abnormal, you need to consult with your surgeon. You may experience pain for the first 1 or 2 nights, which is again normal, and your surgeon will prescribe painkillers for this cause, and that is about the pain and how to care for the wound and the scars after the surgery. Upon the completion of surgery, your surgeon will provide you with a kit that contains a sterile saline solution for you to apply for the next 3 to 5 days, with wetting the gauze with the saline solution and applying it on the donor sites or the transplanted area without directly touching the wounds, and a steady pressure for 30 to 60 minutes twice a day is recommended. This helps with keeping the area moist and speeding the healing process. Another prescription is going to be an ointment to reduce crusts that form after the surgery, and prevent the transplanted area or the donor site from drying out. You will also be given gauze to apply on the wound in case of light bleeding, with pressuring the gauze on the wound, and again, not touching the grafts directly. In case of swelling, which is normal for the first few days after surgery, the only thing you can do is to sleep for the next, at least for the next 3 nights, with your head elevated, as I explained before, with the use of pillow or sleeping on a recliner. This swelling is normal in the forehead, and with time and gravity this may descend to the eyelids, which is nothing to worry about. It is rare, but it's nothing to worry about, and it's not going to be permanent. In case of infection, which is rare, you need to avoid exposure to dirt in the air for 2 weeks after the surgery, either by being outdoors or in your work area, and avoid touching the wounds unless your hands are completely clean. These will help with infections. And in cases, your surgeon will also prescribe antibiotics if they are necessary. So after the surgery, how long will it take to go back to normal life? For 1 week after the surgery, you need to avoid heavy activities, heavy work or sport for 1 week at least, and avoid heavy lifting or swimming in chlorinated water for about 10 to 14 days after the surgery. Some people may want to get back to work a day after surgery, but as light bleeding, swelling, and crusting is normal after surgery, some people may take 3 to 5 days off and stay at home and rest to care for the wound. So it is up to you. And the crusts will usually come off after 7 to 10 days, which is normal. How to wash and care for your hair. On the day after surgery, you can take a shower, but with being careful to washing your hair or the area very gently, and avoid the direct beating of water on the recipient area, as it may cause the transplanted grafts to dislodge. So you have to be careful about that. Usually it is recommended to use a cup for rinsing your head for 3 to 5 days after the surgery, and you need to avoid catching the hair grafts or manipulating the hair grafts with your fingers and fingernails. Hair sprays and mousse can be used after 1 week only if they are washed daily. And when combing your hair, you need to be careful to avoid dislodging the grafts, and you need to avoid hair dryers, especially hot ones, for 1 to 2 weeks. Hair colors, perming or haircuts can be done once all crusts have fallen off, and the sutures on the donor side, which is usually the back of your head, will be removed usually after 14 days, and the crusts, as I said, usually come off after 7 to 10 days. And I think we have covered the basics of the aftercare for transplant surgery. And if you have any questions regarding this procedure or any concerns, you can contact us through our website, hotlines, WhatsApp, Facebook, and Instagram, and we will get back to you as soon as possible and accommodate your queries. Thank you for being with me again, and have a nice day. Thank you and bye.